Today, we're going to discuss how to properly document and code active cancer or history of cancer, and how to identify primary cancer versus secondary cancer. In order to properly code for cancer, you must first answer these questions. Has the cancer been completely removed or eradicated? If so, then it has become a history of cancer. Is the patient receiving any current treatment for the condition? If so, then it's still active cancer. Did the patient refuse treatment for the cancer? If so, then it is an active cancer for the rest of that patient's life. Other questions include, what is the histological type or behavior of the neoplasm? Is it a primary site, or is it metastatic or secondary? And is the cancer of a primary, secondary, or unknown site? Active cancer may be documented and coded when a patient is currently undergoing specific treatment or has refused treatment for cancer. A patient is being treated by means of surgery, immunotherapy, chemotherapy, and/or radiation therapy. There is a high risk of recurrence and a patient is placed on watchful waiting, or a patient is receiving adjuvant therapy or anti-cancer drugs after or combined with another form of cancer treatment to prevent recurrence, or when there is a significant risk that undetected cancer cells may still be present. You may document cancer as having no evidence of disease and use personal history Z codes when the primary malignancy has been excised and there is no active disease, all treatment has been completed, there is no evidence of any existing malignancy, and the patient is not undergoing adjuvant treatment. It is important that your documentation reflects the active cancer as being primary or metastatic. If your patient has no history of cancer but is taking prophylactic cancer drugs, do not report active or history of cancer. Simply report the reason for the prescription. As a final note, do not confuse personal history with in remission. A patient with lymphoma goes into remission. They are never a history of. There are codes for leukemia, multiple myeloma, and malignant plasma cell neoplasms that also indicate whether the condition has achieved remission. Thank you for watching. I'm Dr. Tharp, and this has been your MRA Tip of the Day.